Our speaker is Sandra Salverson, PharmD, BCPS. Sandra is a visionary pharmacy executive who leads OSF HealthCare's $2 billion pharmacy enterprise, guiding 494 employees through rapid change and complexity. Sandra's mission centers on optimizing drug therapy to prevent biologic and financial toxicity, leveraging advanced analytics, technology, and performance improvements to deliver high-value care even in uncertain times. She has steered the organization to focus on a high-quality business excellence mindset for performance, earning national recognition as the first large integrated health system to receive the ASHP Center for Excellence in Pharmacy Practice and Medication Use Safety. With an MBA and a Doctor of Pharmacy with honors, Sandra's career is marked by strategic expansion, seamless integration of new business models, and a culture of engagement that thrives amid disruption. Dr. Salverson, thank you for being with us today.
Thanks, Melissa, for the introduction. I will start the conversation. I have no conflicts of interest to disclose. Actually, today is really about OSF HealthCare's journey for reward and recognition for our technicians. Our primary objectives is to describe the framework for advancement across practice settings and the size of practice to achieve a system-level career path for pharmacy technicians, to list practice competency domains that you could align across different practice settings, and to outline at least 2 outcome measures associated with implementation of a career ladder or Lattice progression program. So I'd like to start with the opportunity. When we talk about engagement, on the left-hand side of the screen, you can see OSF HealthCare's our collective pharmacy technician engagement, and this was 2018 through 2021. I've highlighted some core pieces. Anything above a 4 is considered really progression towards excellence. Anything less than 2 is definitely in the lower tiers of benchmarking and desired state. We were average, middle of the road, and we were kind of stuck in a rut, especially around career development. You can see the dip in my pay is fair, as well as some pretty decent satisfaction with what how we use people's skills and abilities. The second dilemma that we were facing is we definitely saw a large uptick in our overall turnover of pharmacy technicians across practice settings. This is cumulative. The turquoise bar talks about our total turnover, so whether that's voluntary or involuntary. We focus especially on the voluntary, those that are leaving for other opportunities. And we were hitting up to 25% when we had been year over year, between the 10 and 15%, depending on the time of year. So a little bit about OSF HealthCare for context. We have 549 mission partners now. We are 18 hospitals, 1 home infusion pharmacy, 1 specialty with 6 community pharmacies. We have an e-pharmacy that provides remote order verification and pharmacist consultative services, and an integrated distribution center that really takes care of literally distributing all of the drugs to our sites of care. We are spread on the upper 2/3 of Illinois, and then we have 1 location up in the Upper Peninsula of Michigan. So as we looked at those opportunities and said, where do we want to head? Back in 2021, we said, and by 2022, we want to at least move the belief on pay is fair. We wanted to have less than 25% turnover, and that have at least achieve an 83% believe that OSF offers career development opportunities. And then if I look all the way over to the right, through those different time markers, we said by 2025, we wanted to achieve ASHP's Practice Advancement Initiative objectives, especially around the technician groupings, and have 20% of our technicians in advanced roles. So the approach we took, we actually borrowed some rigor. We used a modified Delphi method. And so what is a modified Delphi method? It really, you're gathering a lot of feedback, gathering some ideas and statements, and then narrowing it down through a repetitive voting and prioritization framework involving a fixed number of individuals so that you come out with a framework at the end. We also, before we started actually doing some of the voting, we identified our key stakeholders as the first step, looking at our leaders as well as partnering with human resources. The second piece that we did is we really scanned the environment. And for us, scanning the environment looked like, what does the pharmacy forecast show? There's the high value pharmacy enterprise white papers that are out there. We did some literature review. Practice Advancement Initiative 2030 from ASHP has some very specific technician advancement recommendations as we looked for other white papers or OSF standards. Then we went through that actual Delphi method. So we identified our list of competencies, identified truly unique competencies for a setting, like where don't we have common ground, and then looked at what does it take to master that competency. And then we engaged a second set of key stakeholders, namely our managers who shared with other technicians around for blind spots and clarity. And that's what it took to finally draft the initial progression framework. For that environment scan, the summary that I take away, we've been really working on that technician workforce. In 2018, the pharmacy forecast indicated that we need to compensate equitably for credential and level of responsibility. That really continued in 2019 with the addition of advanced roles and certificate training. In 2020, the forecast really predicted we needed to look for appropriate compensation for sterile compounding. And then in 2021, there should be minimum requirements for advanced roles, as well as consider leadership positions for our pharmacy technicians. The call to action that we really reflected on was when ASHP also published its Practice Advancement Initiative for 2030, which was around 2021, that had three different focuses. One, the practice focused, again, focusing on advanced technician roles and responsibilities. Organization focused, so that's when I think about my responsibility across a whole health system, looking at completing an ASHP or ACPE accredited program, having the standard of PTCB or other certification, as well as foster development of career paths. And then the focused initiative ASHP put out by 2024 really wanted to increase the number of health systems utilizing pharmacy technicians in advanced roles to 20% or a 20% increase from where you were. When we looked at the literature back in 2021, we performed a survey. We got some pharmacist-focused feedback. We went to state meetings. There were presentations shared with us in Illinois, Tennessee, and Texas. We didn't travel to Tennessee and Texas, but the life of Google certainly helps you out. The one thing we would note is there were really no outcomes shared. There was a lot of framework or recommendations, but no one necessarily looking back to say like whether it worked or did it improve. Between 2021 and 2025, there were 4 peer-reviewed publications, and we saw more structure and outcome focused, but this was also during the time when OSF was looking at what we needed to do and how we needed to come through. I do have those references at the end of the presentation if you're curious for what others have also done in the last 4 years in particular. We also did some internal benchmarking. So there is a lot of vocabulary differences, especially when you talk with our human resource business partners, the differences between ladder, level, and lattice. So the primary part is ladder, you usually stay in the same position and you're developing skills, and you could receive recognition in a professional development capacity. Maybe that's monetary support for that development. We chose to focus on levels and lattices, in part because we have so many practice settings represented across the health system. And then from a level perspective, you're actually moving through a vertical series of positions. It could be in the same job family, and it's normally one-dimensional progression. So for example, if you're in the hospital setting or the community setting, you're staying in that, but you're progressing within the levels of responsibility. The focus on a level program is very competency oriented. There's recognition of certificates as well as complexity of responsibility. And generally the recognition is within job code and title and compensation. That doesn't mean that professional development is not available. It's just more formal and is directly tied to pay. In the lattice, take the level and then just create a matrix so you can have both vertical and horizontal movement. We appreciated that difference because as we also saw, people would move between areas of practice for potentially different pay or different skill. And we found our reward and recognition was not very matched. And so this lattice attracted us. Again, it's competency, certificate, breadth of skills based, as well as job code, title, and compensation. So to give you an example of competency mastery, I'm going to take one of the elements, which we call data management, and give you differences of what a level 1 to a lead function could look like. So in data management, and this is from regardless of practice setting, that might look like resolving medication discrepancies in an assigned work queue. So that could be claims that are not going through in a community pharmacy setting. That could be narcotic discrepancies in an acute care setting. And in home infusion, that could relate to billing discrepancies that we've seen. If you think about level 2, we move from just resolution to are you able to reconcile on your own independently and self-initiated some of those controlled substance reports, for example. That was one of the examples from the acute care perspective. In level 3, we start thinking about, are you aiding in the data collection for quality assurance? Maybe you're reporting analysis of metrics. Are you participating in performance improvement projects that are related to the data that you're doing from a quality assurance standpoint? And then finally, the lead in terms of competency mastery and data management looks like coordinating and organizing quality assurance. You start to see some of those leadership traits that are still related to data management, but really about trying to bring things together, as well as the skill of interpreting data and making recommendations to leadership. So that's just one of the competencies, but it gives you an idea of how you would progress through the levels and how that connects to competency. So let's use an assessment question to test our knowledge. If you're a new leader in an integrated health system with hospital, community, and critical access, home infusion, 340B offerings, and the health system does not have a development reward program for pharmacy technicians, and you just received your workforce engagement results that are very below benchmark, list the steps in order to use a framework proposal for HR to consider. Okay, so it looks like from the group that many tended toward A, to draft, identify differences, gather stakeholders, competencies, and literature search. And the answer is actually B. It's to gather your stakeholders, perform that literature search, then use that to base some of the competencies and structure that you can do, identify the differences, and draft your proposal. Thinking about building from the feedback to the evidence to what is actually happening before you draft your proposal. One of our other challenges is size does not necessarily correlate with the skill or competency need. As I shared the map of OSF HealthCare, we have a lot of critical access hospitals, and a critical access hospital might have one pharmacist and one technician. The same with some of our rural communities in a community pharmacy. It is still on the smaller scale. So again, one pharmacist, one technician. That doesn't mean that they're not developing or having those skill-based needs. And you can see the breadth of what we had from very small to large, which also adds some additional complexity to our problem solving because we think about our values as an organization of how we also want to recognize, reward, and do our work. So we entered into a discernment process, really thinking about the values of our organization, which include justice, compassion, supportive work environment, and stewardship. And thinking about all of those as we ask some really hard questions. And none of these questions are meant to be offensive. These are real questions that we had for ourselves is, does the physical intensity of work deserve a higher level? Are patient conversations less skilled than sterile compounding? How does centralization of services influence our model? And if a skill is performed once a week versus every day, is that a valid competency? Because maybe you're not exposed every day because of the size of your facility. So we really had to wrestle with this, and you'll see the output of what we have as I continue through the presentation. So here's the competency list that we put together. We blended acute, community specialty, and home care. We intentionally carved out 340B because it did not seem to have some of the same competencies at this for this particular model. And all of the Black texted competencies are the things that we had in common. We did identify that there are competencies that are different in the acute care setting, community specialty, and home care. Namely, maybe we're looking at non-patient specific dispensing. Or in community specialty, there's a lot more with payment handling or program enrollment than there are in any other settings. And home care had insurance verification. And then we have compounding. In our community pharmacies, we don't have as much technician compounding. That's primarily done by a pharmacist. Part of that is just the mix of where things are. And so we had to think about how does that influence our difference. So when we look at the progression of competency, again, this gives another perspective. We took technology and we said, regardless of the practice setting, again, level 1 would operate technology systems proficiently. Level 2 looks like operating technology proficiently and troubleshooting, regardless the software or equipment with vendor to achieve the solution. That was pretty consistent across all of our practice settings. Then when we move to level 3, we think about not only troubleshooting, but how are you proactive, optimizing technology to perform and maybe performing preventative maintenance. And then leads, we think about how are you operating that technology proficiently to actually providing ideas for optimization and coordinating the work. Again, giving another example of how you can progress through competency and not necessarily list through all the different technical systems that we have, because we have a lot of differences between those practice settings. So assessment question number 2, you are a new leader in an integrated health system with hospital, which means community and critical access, home infusion, and 340B offerings. We do not have a development reward program for pharmacy technicians. And again, you just received your workforce engagement results that are below benchmark. So select the practice competency that cannot, emphasize on the not, be applied to all practice settings, and those settings being community, hospital, home infusion. Okay, we have a lot more alignment on this particular answer, which is decompounding, and that is true. All of those practice settings that we highlighted, in our experience, the data management, pharmacy technology, and inventory management were done everywhere. And compounding was the one differentiator that was not consistent in each of those settings. So what did it look like after we looked at from the framework and how the progression comes to be? This is the best illustration that we can give, and then we do some assessments along with it. We've also considered the types of licensure. So when someone comes in as a pharmacy technician, or they might have come as a grandfathered technician, really we have unlimited positions. We don't necessarily need to approve FTEs, but these people are evaluated for promotion twice a year if they take the certification test. But certified technician, we consider equivalent with grandfathered technician. We still have a fair amount, and we were really looking at that justice and equity. So then once our technicians have completed that certification technician, there is the ability to move up to a second, third, or lead level. Again, it's based on those practice competencies. We have an assessment tool. We encourage our technicians to talk with their one-up, their supervisor, their pharmacist about where they want to go. And those positions are unlimited. So in other words, we're not approving net new FTEs for these type of positions. It moves like within that piece, within the pharmacy family, and they're available to be promoted twice per year. And it does include a pay change. The lead pharmacy technician, we have opted to limit the number of positions and posted. These are advanced skills. Sometimes our departments are not large enough to support some of those coordination efforts, and we took that into consideration. And that's why there's a limited number of positions. But we don't necessarily restrict to what those leads are coordinating, because it can differ from site to site depending on how they're structured or how their workflows work. And then lastly, we had some pharmacy technician supervisors, and we're advocating for this as we continue to grow or change within our departments. You can see the criteria. This is also a limited number of positions. It's a posted job. The reason for the limited number of positions, if you are a leader on this call, maybe you've heard of HR calling and saying, you have a span of control or so many people that you can supervise. And so it is dependent upon both skills as well as the number of people in your department. So for example, it's very challenging for us to implement a pharmacy technician supervisor in a critical access hospital. However, they can progress up to a pharmacy technician 3. I'm less likely to be a lead just because, again, of what they might be coordinating. We are looking at regional roles in addition to this. So what's the procedure look like? In terms of promotions, we still prefer to hire technicians who have completed their CPHT or other valid national certification. When we hire non-certified, we really work to promote them as soon as we can into that certification. And we hire most people in as a certified Tech 1 until the 90-day orientation is complete. That gives us time to get to know everybody and their competency and level of skill. And then the promotion assessment is performed biannually. If we have an internal transfer, which we see, maybe I don't want to do community anymore, I want to transfer to the hospital, or maybe I want to go into our home infusion setting because I really like sterile compounding and that's where I feel most at home. All of our technicians have the ability to maintain that same level of job when transferring to that alternative practice setting. We assume that that level is going to continue, even though there's nuances in that next practice setting. And then there's 90 days to confirm competency and proficiency. And we haven't had anyone that's gone down a level based on a practice setting transfer. The other element that we worked on is support for development and growth. So that started with, as we introduced the model, to sponsor the payment for professional development certificates. Technicians often have the PTCB or other certification, but there's some advanced certificates that can be achieved. And as we wanted to promote their own growth in what that is, OSF is paying for those certificates. Then we moved to an organization-sponsored non-degree educational benefit program. So this came less from the pharmacy, but recognizing that not everyone is looking for an advanced degree or an initial bachelor's degree. And so we looked at ways that there are healthcare training programs and how the organization can support that. And that extends beyond our pharmacy technicians. We've had phlebotomists participate, our lab technicians, some of even our transporters. It's really looking at internal organizational growth. Then we also implemented, when we did this non-degree educational benefit program, there was a partnership with MedCerts. So we have a specific talent development platform to support our pharmacy technicians or for those who are interested in entering into the profession of pharmacy. And then the last part is our talent development platform. And there is some additional, we've rolled the division sponsorship of certificates to now that the organization has incorporated those pharmacy-specific certificates in its reimbursement model. So here's our results. As of 2025, We're a little shy of the ASHP objective, but we have 19% of our pharmacy technicians that are in advanced roles with both certified or certificates. You can see where on the left is where we were right after implementation. And on the right, you can also see by practice area how far that we've come. We've definitely moved more into the Technician 3. Some of this is internal motivation, and there's high adoption in community specialty hospital, and home infusion is really leading the way from our Tech 3 of interest and specialty roles. Then I look at what are our outcomes. In terms of retention, in October 2021, we had about 25% of our mission partners, sorry, that's what we call our employees, that were typically here less than a year. We had moderate retention for 1 to 2 years, and then you can see we're about 32-ish% of those that would stay with us greater than 10 years. We have definitely seen a shift in 2025. We have cut in half those employees, pharmacy technicians that are here with us less than a year. And we continue to keep about 45% in that 1 to 10 year timeframe. And then we've stayed around the same in terms of keeping people more than 10 years. The other areas of outcomes, I've extended the graphs is what I would say. When I started the presentation, it was through 2021. You can definitely see the dip. The gray bar is about the provision of career development opportunities. And you can see this steady increase for our pharmacy technicians. And we are exceeding some of the national healthcare benchmarks when it comes to this group. Which was delightful. And that's not why we did it. We did it really because we care about how we support our technicians here within OSF HealthCare. The use of skills and abilities has also climbed a bit, and it's remained pretty steady. And then the last element I would like to call out is pay. Pay is really difficult to move. We saw a definite improvement. It's just really hard. This is one of the profession's dilemmas as we think about what is appropriate pay and compensation, and you have market analysis, and the economy is not making things good. So that is one outlier that we are still working on, while also thinking about the global context of financial stewardship within healthcare today. On the right, you can see the results of our pharmacy technician turnover. You can see those peaks, which were in that 21, 22 before we implemented our program, and then the steady decline of turnover that has happened since that implementation. I, in particular, focus on that middle blue line, which again is our voluntary turnover, people that are leaving because we are maybe not offering a satisfactory work environment. And we are sitting around the 10% mark right now. We still, when we look at total turnover, that includes both involuntary and voluntary turnover. Our next object is to how do we become more transparent and more clear about what job expectations are upon hire, so that people have a better understanding of the skills needed as we try to find a best fit. So that brings me to assessment question number 3. It's the same scenario. The question comes as to what outcome would you propose to measure when pitching the framework? The choices are organizational engagement results, pharmacy technician turnover, number of job descriptions, or pharmacist engagement scores about burnout. The leading answer by the audience is pharmacy technician turnover, with a second support for organization engagement results. Both are pretty close. For this particular answer, I selected pharmacy technician turnover because it's specific to the goals of the program. It's around technician turnover. And organization engagement results is less correct, only because we really looked at our technician engagement results rather than the entire organization. Number of job descriptions, while that might be a management objective that is beneficial, that is not the objective of the program. And pharmacist engagement scores, may influence how our technicians perceive the work environment, but it is not a direct measure of a career ladder program. So I thank you for your time today. Thanks for listening to our story. And if there are any questions.
It looks like you have one question in the Q&A right now. Becky
Okay.
asks, do you recognize CPHT ADV credentialed techs with higher pay?
We do, Becky. That is one of the requirements that we have for our pharmacy technician supervisor. At this time, we haven't had a lot of interest in that advanced role, and we've recently had one inquiry. So we're looking at that right now.
Angela has asked, do you recognize certs from the military?
I have not had that question, Angela. I'm going to make an assumption that there's some certifications from the military that are related to technician work. We do have an appeals process. If something is not in our structure today, we would vet that and use some of the CPHT certificates as standard. Like, does it have a similar rigor to it to evaluate whether that would qualify? And that would be whether it's for the military or if someone else found an alternative certificate that seemed to be aligned with the program.
What is your process for buy-in from administration and HR for the technician compensation?
I would say we have high buy-in. When we looked at technician turnover, turnover is a really important metric for OSF HealthCare as an overall whole. And so they came to us with some of that, those additional organizational professional development program, and they had prioritized just based on overall metrics that we reimburse, and we think about the MedCerts program and how that is. And that's not that we weren't having conversations, but the door was like mutually open. And so I would say then as we talked about this, I have conversations regularly with our human resource leaders, especially around our pharmacy technicians, and I have not had a lot of objections. There are times that when we talk about pay, that sometimes the answer is no, right? And that's just a reality for where we're at. But we tried to come up with creative solutions together to figure out what recognition and reward looks like. Another important point, I know that we are very blessed to have that partnership, and that is not always present everywhere else.
Thank you. We've gotten lots of thank yous. Always enjoy your presentations, great topics in the chat. So
Well,
thank you
thanks for
again.
the opportunity today. Have a great day, everyone.